Welcome back, everyone, to another episode of TrekWars at OSU. That's Oregon State University. My name is Dr. Joseph Orosco, and I'm a professor of philosophy at Oregon State University. I'm also the co-director of the Anarres Project for Alternative Futures. The Anarres Project is a forum for conversations, initiatives, and projects that imagines a future free of exploitation, domination, oppression, war, and empire. One of the projects that we do here at the Anarres Project is this one, TrekWars at OSU, in which we examine the major sci-fi universes of Star Trek and Star Wars and some other sci-fi franchises to help us make sense of developments in our current social, political, and economic life. And today, I have a very special discussion about Voyager and public health. My guest today is Dr. Diana Rohlman. Dr. Roleman is an assistant research professor at Oregon State University in the College of Public Health and Human Sciences. She is an author of science fiction and fantasy. Her work is primarily in toxicology, but for many years now, she has been teaching in the Oregon State University Honors College. She teaches a class on research ethics using primarily the Star Trek series Voyager. So I've asked her today to talk a little bit about her love of Voyager and how Voyager helps her to think about public health issues in the world today, and particularly, hopefully, to think about the ways in which Star Trek might help us to think about the COVID-19 pandemic. But thanks, Dr. Rohlman, for being here. I appreciate you having some time to talk with us.
Thank you so much for the invitation. I mean, any day I get to talk about Voyager. Good day.
Good. I'm glad that you're here today. I know I mentioned this to you, but happy Star Trek Day. Today is the birthday of Star Trek. On September 8th, 1966, Star Trek first appeared on network television. So I'm grateful to be able to have a conversation with you today about this. And also, we get to talk about Voyager, which I admit is a series that I've only recently, like maybe in the past year or so, really had a chance to do some more deep diving in it. And I've become really impressed with some of the stories. It's still not one of my favorite series, and we can talk about that in particular, but I like a lot some of the stories in it. And so I'm glad to be able to talk with you about this. Someone I know that you've done a lot of work with Voyager episodes, and this being the 25th anniversary of the premiere of Voyager, this sort of seems like a kind of a fitting celebration for Star Trek and Voyager this week. So I want to thank you for being here with us.
Yeah, I'm really happy to talk about it.
Cool. Well, let's talk about Star Trek and you.
Sure.
What was your first experience with Star Trek?
So when I was younger, my parents had a really strict television schedule. It was like 1 hour of TV a day max, and they had to pick the shows. And so this would have been mid-90s. So this was when Voyager was airing. So Voyager was one of the acceptable shows we were allowed to watch. So I grew up with Captain Janeway, 7 of 9. And at the time, I don't think I realized how impactful it was to see this female captain who's also a scientist, right? And there was never any discussion of should she be a captain because she's female or not. She just was. I mean, Captain Janeway is a force of nature, right? And so that was really my only introduction to Star Trek. I probably saw a couple Next Gen episodes, and then I didn't touch it again until I graduated with my PhD. I mean, I spent a lot of time at school, as I know you did as well, and there wasn't a lot of time for television. So I graduated and was like, oh, what does one do now that you're out of the lab and just, working a regular job? So I remembered that I really liked Voyager. So I pulled it up. I started watching season 1, episode 1. And then pretty much that is what I watched exclusively until I finished all 7 seasons. And if you've seen the ending of Voyager, it ripped my heart out. I was bereft. I was like, where do I go from here? So I read the books. And then after that, I started Next Generation, went through that whole thing. Then I did all of Enterprise. Then I did the whole original series with all the movies. And now I'm in season 5 of Deep Space Nine. I'm kind of stuck there right now. And I paused, obviously, to watch all of Star Trek Picard in like 2 days. So
Wow, that's a lot of deep diving into these series.
it's just, I found it so fascinating. And it was when I was watching Star Trek Voyager that I realized, and all of Star Trek is founded on these ethical, philosophical, moral questions about humanity. But it's so much easier to investigate them when it's fictional.
Right, right. Well, I want to touch base with you about that primarily. I also want to hear, if you don't mind. You mentioned that watching Voyager was impactful for you primarily because of the representation of Captain Janeway, right, as a leader and a scientist. What was important about Janeway for you?
I think she knew her job and she did it. And she was so confident in herself. And she also knew how to delegate, and that I think is really important. But there were just qualities of leadership that she had. The show goes through like bad leadership, good leadership, etc. But she took the time to get to know her crew members. She took the time to figure out their strengths, and she could make those hard decisions. But when I rewatch it now as an adult, what is so striking is she makes a decision and her crew supports her. No one undermines her. No one says she's being overly emotional. No one says her voice is too loud. She's the captain, and she got there because of hard work, and she earned the position. And so she was afforded all of the respect to do that. And that's never called out in Star Trek, which I think is so lovely. But that is sort of the hidden importance to me of Captain Janeway.
That's good. Yeah, I think that's right. I think what I like a lot about her is her representation as a leader, like you've said, but also as a scientist, because she's the kind of scientist that is very well-rounded in a way, right? Because when you think about the episodes in which she spends time trying to think, she transports herself over to Leonardo da Vinci's workshop, right? And she thinks about science and technology in this really kind of holistic way and wants to be inspired. And I always thought that was a really sort of powerful kind of image of the scientist in this kind of humanistic element of trying to think about science as a way of knowing and thinking about human problems and social problems and working to try to solve those kinds of things. Something I think that you've tried to do a lot in your own work, right? Yeah. Well, let's talk a little bit about the work that you do. So, as I mentioned at the top, you teach a class here at Oregon State University in the Honors College that's focused on teaching students about research ethics and
bioethics specifically.
Bioethics, right? And looking at public health issues. Can you talk a little bit about the way that you use Star Trek for this class? Like, how do you use Star Trek to teach these issues of bioethics?
Yes. So I'll just do a really quick overview of bioethics. That is the ethical framework that's typically used in the biological sciences. So I'm a toxicologist, public health. That means I work with humans for a lot of my research. I'm maybe taking samples from them, or I'm taking samples from their environment and collecting data from them. So that's the framework we use, and so that's why I teach that framework. There's so many different ethical frameworks, and if you haven't read it, there's a fantastic book by, I think it's Judith Barad, called The Ethics of Star Trek, where she actually breaks down the ethical framework that each show kind of personifies. So Voyager, being helmed by a scientific captain, they do a lot more with sort of bioethics. So the way I use it in the class is I pick 9 episodes that I believe illustrate different aspects of bioethics or related ethical foundations to that, and I assign it as homework. So the very first time I taught the class, I handed out the rubric, or I'm completely blanking on this. Syllabus, that is the word. I handed out the syllabus, and the students start leafing through it, and one kid throws it down and goes, "Oh my gosh, Are we watching Star Trek for homework? I have that exact cup as well that you're drinking from. I mean, they were just thrilled that they were watching Star Trek for homework, but it is very purposeful. So I pick an episode and they have to watch it on their own time. And then they turn in a very short assignment where I've given them a single ethical question that is exemplified by the episode. And then based on their responses, when we get to class, I've divided them into two groups. And so, I mean, the easiest way to describe it would be like one group represents Klingons, one group represents the Federation. And then using that question, they have to debate each other about the ethics of the response from the episode. So I deliberately constrain them to the episode. If they know Star Trek canon, they are allowed to bring that in, which I really enjoy seeing that come about. After we've debated for a bit, then they're allowed to lose their sort of assigned perception, and then they can continue to talk about it within the constraints of Star Trek. And then the second half of the class, we go into a real life example that mirrors what we saw in Star Trek. No pun intended with mirror universe.
Right.
Yeah.
Wow, that's cool. So, so part of this is to prime them by thinking about the issues in the episode, and then you tease out the real life analogy and have them think about what's going on in real life that was mirrored in the episode. Why do you think, so you mentioned a little bit that you thought that Voyager was good about this primarily because it's helmed by a scientist. Is there a particular reason why you choose to use Voyager to think about these kinds of issues in your class?
It wasn't so much that I sat down and said, I want to use Voyager. By the time I was teaching the class, I had made my way through Voyager, Next Gen, Enterprise, and the original series. So I actually was picking ethical concepts that I wanted to debate in the class and that I wanted students to be aware of and learn how to apply them. And so once I had those concepts in mind, I went and found episodes that best fit them. And it just so happened that Voyager tended to have the best fit in many cases. So at this point, I think I have 5 Voyager episodes, 4 Next Gen, and 1 original series. So the students actually do get to see kind of it. I used to have an Enterprise episode. People really do not like Star Trek Enterprise.
Really?
Yeah, they really didn't like it, but it's such a good episode. So I'm going to be teaching a part 2 of the class, so that episode goes back in because it talks about the autonomy of people when you're giving them their own data back, which is something that in the real world we're just now starting to grapple with. Researchers never used to give data back to the people they studied.
Right.
So there's this huge ethical discussion that needs to be had around that. And Star Trek Enterprise has this beautiful episode that directly addresses that.
So what is it about Enterprise that your students didn't like?
Oddly, they just really disliked the fact that there was vocals in the theme song.
Right.
That was one.
Well, I hate that song too.
Yeah, it's not great, and then like they change it halfway through. I actually really liked Enterprise. I mean, I will say it was sort of disheartening when you look at the diversity that's exemplified by like Voyager, for example, and then you go back to Enterprise, which actually aired much later, and it's not as diverse a cast. And I think that's upset some people. I mean, I was just at a virtual Star Trek convention, and they mentioned that there's this test you can do on television shows, and I'm forgetting the name of it, but it's how often are there 2 females on screen having a conversation for more than 30 seconds that's not about a man. Right. And if you chart Star Trek, and someone has done this, which is genius, they could actually say, like, going from the original series wasn't great, but you could see this improvement, and then you hit Enterprise.
Right. Yeah, that's the Bechdel test. Right.
Thank you.
Yeah. No, I agree. I mean, I think I liked Enterprise. I think after about the 3rd season, it started to get its feet and start to really fill in some interesting storylines to canon. but it took a while to get there. And the whole Zindi War kind of thing, which I think was their attempt to try to deal with the issues of 9/11, where it was not particularly convincing to me. And so, but yeah, I think that it was an interesting time for Star Trek, and you know, this sort of post 9/11 kind of thing, trying to figure out where to go. And it's really fascinating to see like the renaissance of Star Trek now with all these different kinds of series that goes in a really different direction in terms of representation, diversity, and perspective. So, but that's a different kind of question to sort of focus on. Can I ask you, in your class, what are the kinds of issues that you talk about with your students? And is there an example that you can give of an episode that you use that helps to highlight one of these issues in particular in a good way?
I think the one I would just talk about the most, this is one of my favorite episodes. My students actually tend not to like it, and I can talk about why I think that is, but it's called The Scientific Method, and it's a Voyager episode.
Mm-hmm.
And I'll try and give a super brief synopsis, but it's essentially this other group of aliens. They have a device where they can exist in a different wavelength, so they're not visible. So they're able to infiltrate Starship Voyager, and they're able to conduct experiments on the crew without the crew knowing. And these are not mundane, simplistic experiments, right? They're not just like checking blood pressure. They're actually altering the way DNA is expressed. And so these experiments go rapidly from minor to actually fatal in some cases. And when they're finally found out, Janeway confronts them and says, you know, you never asked our permission to do these experiments. And what is the benefit even to us? You know, you're killing our people, you're harming us, and for what? And the aliens explained that deception was a necessary part of their study. Because if you knew that they were doing psychology experiments, that would alter your behavior. And they also said, you know, if we asked you, you probably would have said, we can't do these experiments, but our need for this data is so great that we felt it was appropriate to do this. And then there's this whole area where they say, we're now going to coerce you to stay in the study. If you don't allow us to continue, we will just begin killing you off. Or if you don't allow us to study you, we'll begin killing you off, which kind of equates to the same thing. At which case, Janeway, who's at this point been driven slightly insane from the experiments they're doing on her mind, drives them straight into, I want to say, a nebula or something, which in typical Star Trek fashion, everyone survives, the aliens go away, and the EMH doctor is able to fix everyone, right? But what is so beautiful about that episode is it highlights every single underlying principle of bioethics. So you have to ask people for consent in your experiments. You need to make sure that your research does not unduly harm people. You need to identify that you're doing this for a stated benefit. And then it also brings up this idea of justice, which was actually a principle that was added later. So it used to be autonomy, beneficence, non-maleficence. The idea of justice came out, and that was that if you're doing research, you need to represent many people. You cannot take advantage of one community over another. And in this case, these aliens were taking advantage of Voyager because they knew that they couldn't be seen. So I love that episode for how it breaks it down so clearly. My students hate it because they feel it is too obvious that what the aliens are doing is wrong and unethical. But then we go into the real life study, which is the Tuskegee Syphilis study. And my point to the students is when we learn about these things in history, it's always sort of presented as, and then this awful thing happened. And it is awful. I am not saying it's not, but you don't see the nuance of it. You don't see, like, why did people make that decision, right? In the case of the Tuskegee Syphilis study, it'd be really hard to prove that scientists sat down and were like, we're going to design a truly unethical, awful study. But what you see over the course of that is there was a good question. Syphilis was a public health concern. That was fine. But then the selection of who they were going to study, right, which is African-American tenant farmers, zero literacy. They did not even know they were being studied for syphilis. So you start to see all of these checkpoints of where the research becomes more and more unethical. And at the end of it, it is as simplistic as the aliens versus the Voyager crew, where you did have researchers that were trying to keep people in the dark. They were deceiving them because they wanted to collect more data. So that's an episode that my students struggle with every year. And yet I've continued assigning it because I think you have to see how these things can play out. And Star Trek at least lets you have that discussion at first, right? Where you can say, this is wrong and you would never do this. And then, yeah, there is kind of this crash into reality of, well, this has happened and we need to learn about it so that we don't repeat that in the future.
Well, this is what I was going to ask you about, why you've chosen to teach Star Trek in your class. I think you might have answered this, but I wanted to get you to comment on this. It seems as though using Star Trek as a tool to talk about these issues is useful because it helps ease people into the issues that you really want to talk about, rather than sort of hitting them over the head first off with the Tuskegee syphilis experiment. You show the scientific method and get them to sort of think about the issues in some way, and then you can sort of deepen the lesson by showing the historical truth that's underlying that episode. Is that how you use the stuff? Yeah.
That is. I think because it's Star Trek, we don't take our preconceived notions of what's right and what's wrong, and we don't have emotional attachments, right? A lot of these things we've learned about before, or even if we haven't learned about it before, it's maybe a group of people we're familiar with, or you're one of those people, right? So if you're already bringing that emotion to the table, it can be difficult to sort of take a step back and evaluate. But with Star Trek, that's very easy, right? Most people don't have preconceived notions about holographic life forms, for example. So you can sort of explore those ethical scenarios sort of free of guilt in a way. I guess that's not the best way to say it, but that's really difficult to do with the Tuskegee syphilis study, right? Because it was wrong, it was unethical. So this way, at least you can talk about it in Star Trek.
Right. What have you learned about Star Trek as you've taught these classes? What's your appreciation of Star Trek? How has it changed at all by using it as a tool to teach these really hard lessons about public health ethics?
I think I just so much more appreciate how Star Trek can be used to talk about ethics, morality, and philosophy. And I didn't realize just how much every episode was about that. And so, sorry, you're gonna be able to hear this. My dog has decided it's time to drink water right next to the desk.
Welcome.
She's a Trek fan as well. It's looking at all of these different things. And so every time now I watch an episode, there's always like some connection back to something that's happening in real life, good, bad, indifferent. So I think I've just really been impressed by how good of a teaching tool this can be, right? I always do laugh when at the end of the term, my students will tell me, I'd never watched Star Trek before, and now I'm trying to watch the rest of the season, and my roommates are, sitting down to do homework with me because they want to watch it. And I always laugh. I'm like, yay, I've converted another Trekkie. But I think the reason they start watching it is because, yeah, it can be a fun show. It can be an escape from reality, but it also makes you think about things a little bit differently. I mean, I think we've talked about this episode 2 Vix. Right? It's another Voyager one. After watching that show, that messed with my head. You're walking around for days just being like, I don't know what the right answer was. Should you have done this? Should you have not? And I try to get some element of that in every episode I assign, where it's not just this simple follow steps 1 through 3 and you'll be an ethical person, because ethics doesn't work that way. And Star Trek has a really unique platform to explore these different endings and these different pathways.
Right, the Tuvix episode where there's the transporter malfunction that creates a a new
Mark,
person,
yeah,
right, out of Tuvok and Neelix,
yeah.
Tuvix, who then has to be torn apart at the end under Janeway's orders to reconstitute the two separate individuals.
Hmm.
That's one of the ones that Janeway gets a lot of flack for, right? I see memes all over the place calling her a murderer for what
Yeah,
she did to Tuvix. Yeah, so that is a hard one to try to figure out, because that's a question then about like autonomy,
yeah,
personhood, right?
yes.
So
And when people don't have the ability to speak for themselves,
yeah.
who speaks for them? And how do you make those ethical decisions? And that's still an episode. I don't know how it, because the writers, maybe deliberately, or maybe they're just like, shoot, we've written ourselves into a hole and we don't know how to get out of it. But they never go back and ask Tuvok and Neelix how they felt.
Mm. Right, right. Well, this is a longer conversation to have maybe at some point, but this is partly one of my beefs with Voyager in particular, but a lot of other Star Trek too, was that this is sort of pre-discovery. That a lot of Star Trek, maybe with the exception of DS9 in that era, there's so much traumatic stuff that happens to people. And by the end of the episode, a lot of it just gets forgotten, and then they move on, and then the next week they're on to some new challenge.
Or the tricorder fixes everything.
Right, and so especially with Voyager, right, there was some really hard stuff that happens to a lot of people. I mean, like for instance, Harry Kim dies,
Yes.
and
Yes.
and he, you know, what is it? His doppelganger, his twin, his clone is the one that is.
No, they went through something and the ship was duplicated. And the ship that Harry Kim was on, well, so he was on both. So they all had duplicates, but one ship had to self-destruct to save
No,
the other ship.
yeah.
So the Harry Kim that was on the ship that was about to self-destruct got sent through to the one that was going to continue on.
Yeah.
Yeah.
That's you know, there's some very interesting things going on there, and then everyone is better for the next week, and so it's just like, what? And then it's a really sort of I mean, this is the sort of difference between serialized versus long form narrative stories. Like you can start to see in something like Discovery, where trauma lingers in people for a long time and they have to deal with things, right? Similar thing happens with Dr. Culber dies and then is reconstituted in the mycelial network and comes back, and he's trying to figure out if he's really the same person, right? In old kind of Trek, that would have been dealt with in one episode and he would have been ready to go in the next one, and you know, it wouldn't have been mentioned or all. But so it's, you know, this long form now of serial Star Trek is able to deal with some really difficult emotional issues in a perhaps more realistic manner than I think that old Trek was, that reflected in the way that the character arcs go. So,
but I will say the short form, it makes it really nice for class.
yeah, that's exactly right.
There's those benefits as well. Now, obviously they did not write Star Trek, so they're like, clearly you can use this in your classes, but I'll take advantage of that.
Yeah, absolutely. I think, you know, and I know that we've talked about this is partly why when in my Star Trek class where we talk about ethical issues, I primarily use the original series, because that's the sort of classic kind of morality tale in 45 minutes.
Yeah.
And in some cases, the morality tale is so forefronted and obvious that it's really hard to miss in a lot of cases.
Yeah.
Whereas some of the stories get more complicated later on, even though they're still serialized. So that's why I tend to use TOS a lot of the time, just because it's pedagogically, it's a lot easier to sort of tease out these issues in some ways than I think than some of the things like something from DS9, where you'd have to sort of explain a whole lot of character development to get to one episode, perhaps, to understand what's going on. So yeah, I think that that's right. Plus, I use TOS because most of the time my students are of the generations that they've never watched it, so they don't know about it. If anything, they've maybe started watching Star Trek with DS9 or Voyager, and they talk with fond remembrance about their parents watching The Next Generation, but they've never seen TOS, and so for them, it's really alien in that way. So that kind of distance that you were talking about the kind of distance created to be able to explore the issues, they really get that with the TOS because it just seems so foreign, and they like the cheesiness. So there's kind of a, right, there's a kind of a humorous element to it. Especially my students always like burst out laughing whenever the Gorn appears and they get to see that classic battle
Oh yeah.
in the Gorn. So that always gets the best kinds of laughs.
That's interesting. The first time I taught this class, I mean, I had one kid that walked in and was like, I don't even know what the class is really about, but I saw Star Trek, so I signed up. And so I just had Trekkies, right? Now it's, if I have one Trekkie in the class, that's impressive. I am having people that have never seen Star Trek, or if they have, they saw the new movies, right, in the Kelvin timeline. They've maybe seen one or two of those. But so it's pretty interesting to me how you take these people that have never seen Star Trek, and by the end of the term, they're able to see how you can use science fiction to discuss these issues. And they enjoy it, you know? So we do occasionally have discussions about like, what are the Borg and why do the Borg need to operate like this? But we can have all those discussions in the context of class.
Yeah, I think that that's right. I get a lot more Star Wars fans. I think Star Wars as a franchise has done a lot better sort of marketing to young folk to get them interested at earlier and earlier stages. But I think that that's changing now with Star Trek. From what I hear, there's slated to be an even right now. We've seen the premiere in the past month or so of Star Trek Lower Decks, the animated. The new animated series, and then there's another one in development. I believe it's called Star Trek Prodigy. That's going to be for Nickelodeon to get preteens involved.
Wow.
And so it's becoming right. The Star Trek renaissance that we're in, you know, means that I think at any one time there might be at least 5 new series at play. So that'll be interesting to see. Of course, it is all behind the paywall of CBS All Access, and so that makes it a little bit difficult for a lot of people to get into the universe. Well, let's talk about the sort of big question. You know, we are in this period globally, the COVID-19 pandemic. Star Trek in many of its series has dealt with issues of epidemics and pandemics and the ways in which disease can affect people. And, you know, miraculously, you know, the EMH or Dr. McCoy or Beverly Crusher comes up with something or other at the end of the episode that cures everyone. Except there's this one episode, I was just thinking about this, there's this one episode of DS9 where Julian is trying to come up with a cure to a disease and he can't do it. And at the end, he's able to come up with a treatment that sort of ameliorates the disease, but you see him very frustrated and trying to come up with a cure and he can't do it. It's a very grim 2-parter, I remember. So I remember that one. But the big question is I wanted to ask you is, do you think that there are any lessons that we can get from Star Trek of any of the series that you know of about how to deal with the COVID-19 pandemic? Is there anything that Star Trek teaches us about thinking about our current moment in that way?
Yes, and I've been trying to think of a way to put this, you know, very succinctly and concisely, and I have not. Really, the only thing I could come up with in terms of how do we apply Star Trek to this moment goes back to the whole reason I taught the class, is we can use Star Trek to envision future scenarios and play out those scenarios, good, bad, evil, and how would we as humans want to move forward? So, I mean, as you mentioned, there's so many Star Trek episodes. Even just in Voyager, there's the Vidian storyline, which is early in the series, where it's a race of aliens that have this horrendous plague, and as their organs fail, they're just going out to other aliens, harvesting organs without consent to keep themselves alive. And the idea there is they have been driven by sheer desperation to these measures. And then there's a later episode called Critical Care, where the EMH doctor is stolen and he's put on this planet that has extremely limited resources. And so they have these discussions of who gets the resource when you don't have enough. And these are things we're seeing with COVID, right? I mean, as soon as COVID hit, people were talking about, or am I getting confused with E-Valley? I might be. But I think also with COVID, you can correct me on this, I believe some people needed lung transplants. Is that sounding familiar to you?
That sounds, yeah, I do hear
Yeah.
something about that, yeah.
So there was also the vaping epidemic where we
Yeah,
saw
yeah, yeah, yeah,
that. But then we did run into these limited resources where it was coming down to who gets a hospital bed,
yeah.
right? Not even the ventilator or drugs, but just a hospital bed. And in many cases, no one had really ever considered those questions, right? Now, obviously, medical professionals have considered these questions, but when it becomes a global issue and people are starting to realize, okay, if I show up at the hospital at the same time as 10 other people and there's 2 beds, who gets those and how do we deal with that? And that wasn't a conversation we'd had. And the scientific community is starting to have these conversations. This started with Ebola, really, when it was just who gets the experimental vaccines. And then that turns into this question of, okay, one, you have limited vaccine, but now 2, who do you give it to? Do you give it to the healthcare workers, who in the case of Ebola tended to be people coming in from other countries that were predominantly white, or do you give it to the people that are actually suffering from Ebola? And at the time, the decision was made to give it to the white healthcare workers. And there's actually an ethical perspective behind that, which was not well communicated. And so I think we're going to be heading towards that with COVID, where now everyone in the world is going to need a vaccine. We don't have the capacity to create those vaccines. So who gets it first? Who gets it second? How do you make sure that it's equitably distributed? And I think there's a lot of lessons Star Trek offers to walk through those conversations.
Yeah, I think that's a big deal. I think I've told you this before. In my Star Trek class that I taught for the first time remotely last spring,
I did too.
when Oregon State started to go remotely and everything was done online. I did a version of the Star Trek class, and I included, since I'm the TOS guy, I included this episode, Miri, which is the episode in which the crew beams down to this planet that's just sort of known as Earth 2. And it's had a global pandemic that has wiped out all the adults. So there was these weird kind of resonance with what was going on with COVID-19, and all that was left were children.
Mm-hmm.
And there was this question about dwindling resources amongst the children, right, and whether they were going to be able to live. And we tried to talk about the ways in which Star Trek might deal with some of the issues based on the episode in Miri. And what's interesting about Miri is it may not seem immediately obvious about what's going on there being analogous to something that's going on with COVID. But the way I looked at this is the classic scene in Miri is that the crew of the Enterprise has gotten the virus that was engineered by the Earth 2 scientists to prolong life. And it created this cascade effect in which it killed everyone above the age of something like 15, 16 years old. Essentially, the idea is that once you start to get puberty, you start to age really rapidly and then you die. But for children, their longevity is increased. So the point is that maybe 100 years is about a month's worth of aging for them. So the planet is filled with these really old children, but once they start to go to puberty, they then die. And there's a story about how the crew gets their equipment stolen by the children, and they are sick and turning on each other. And they're trying to get the equipment so that they can get back to having computers on the Enterprise that will help them to decide whether or not the vaccine that Dr. McCoy has created will actually cure them. I use this part of the episode to talk about the question of how do we react to pandemics, and particularly what was going on at the time was there was no toilet paper in the stores,
Yeah.
right? And so how would we react to resource chains breaking down and people turning on one another to be able to get access to medicine or to get access to beds? And what was interesting about that episode is that I told my students, I said, look, I think that, a lot of people feel that this is a really dark moment, and that, we're turning on each other, and human beings are really greedy and self-interested, and they will do everything they can to get what they need above other people. But I said, this episode really shows a different kind of story, in the fact that at the end of it, Kirk has to give this kind of speech to the children. Even though they beat him up and they hit him with a lead pipe and all this kind of stuff, he doesn't force them to turn over the communicator. He tries to reason with them about how they're going to die soon if they don't do something about that. And they agree to go along with his plan. And rather than go along the path of like Lord of the Flies, where the children are these evil little beings that will do everything to kill one another and that get in their way, right? Star Trek shows that at the core of it, human beings are these fundamentally cooperative, rational people that if you really appeal to their reasoning and their intellect, you can reach through to people, even in the most dangerous, darkest of times. And so there's a kind of a hopefulness in that Star Trek episode about how to deal with pandemics that is, I think, really interesting, a kind of a lesson to learn for how we react nowadays. There's also the question about like who should get, as you were pointing out, like when there is medicine, or when there are various kinds of medicinal resources that need to be distributed, who should get it, right? Because there's when in that episode, if you know it, McCoy has to decide whether he should use the vaccine on himself first, right, to test it. And so I had a question in my class, like who should get vaccines first if they're developed? And I got a whole variety of different perspectives from my students, right? Some of it was very interesting, and I had to try to get them to think about justifications using ethical theories. And it's interesting to see how the way in which they use these ethical theories can sometimes come up with some sorts of results that are frankly a little shocking. Like one student sort of said, well, we should really give it to younger people in their 20s, because after all, everyone else after that has pretty much already used up their productivity. And if we're talking about the greatest good for the greatest number of people, old people really don't produce all that much for society that's good anymore. And so we should make sure to save all our resources for younger people. And
that's an actual ethical framework that is applied.
Yeah, we talked about that for a long time. I mean, a lot of my other students were just like aghast. They were shocked that this guy was making this argument, but he could put it in the framework of utilitarianism.
Yes.
And so it was a really rich conversation that we had, thinking about who should get the medicine first.
And I think what's so lovely about Star Trek, because we had that same conversation in my class, and as part of our discussion, I do show articles that have been written and saying, here's 10 frameworks that could be applied to this idea of resource allocation. So we had the discussion first in Star Trek, and people said, okay, well, in critical care, which was the episode we were using, the planet had gone far to the extreme, right? Where like only a select few that were deemed important to society received treatment. Everyone else was just viewed as, spare labor, right? So you had this huge divide. And so you could see problems with that form of prioritization. So we used that as the stepping stone. And yeah, I had similar things to that. And then I had students saying, well, okay, but really you do need to protect people that can keep society functioning, right? So we put it in like the series of COVID. If the leading medical expert gets sick and there's only 2 vaccine doses, who get those 2? And everyone said, well, it would be the leading medical expert. I said, okay, then you have 1 dose left. Who gets it? Your father or, the person that's coordinating the vaccine response? And that is where people started to realize, like, yeah, it's really easy in Star Trek because you're not thinking about how this applies to you and to your friends and to your family. And it was funny because most of the class was like, well, like, sorry, Dad, but I'd have to give it to the person who's coordinating this response for the entire United States. And one person goes, no, you only have 1 father. You can just hire another person to do that job. And, there's no wrong, well, there's wrong answers, I'll say that, but it's interesting to see people they feel so certain when it's Star Trek. And it's very common that we finish the Star Trek discussion and people are like, yep, this is what you do. This is ethical. It's always ethical. And then we go into the real life scenario and they're like, I no longer know what I want to do. And I think that's the beauty of being able to sort of foreground the discussion using Star Trek, get them to think about it. It is pretty simplistic, and then you can see how it gets nuanced and difficult. Ethics is not easy.
Wow, no, that's great. That's really fascinating to hear. So a lot of your work that you use for your classes has been Star Trek up to about 2004.
Mm-hmm.
We've been talking about this renaissance now. Have you had a chance to see much Discovery or Picard?
So I watched all of Picard, and I'm probably like halfway through the first season of Discovery. So
What do you think of the new Star Trek?
I like them. I mean, we were talking about earlier, I do kind of miss the serialized, it's a perfectly encapsulated little story. And so I like that. I do like the new ones. And it's so fascinating to look at these series as tackling different aspects of humanity, right? Because TOS was really these more philosophical questions about what does it mean to be human. And then Enterprise was just sort of this, it was like, we have no ethical guiding principles because there was no prime directive. And it was sort of this idea of figure it out on your own. And I guess you could say they were more utilitarian, right? With the Xindi War, it was anything goes as long as we protect Earth.
Right, right.
And then you get to Next Gen, which I would argue is more about moral questions. And again, sort of that understanding of what does it mean to be human. And then Voyager has absolutely elements of utilitarianism, but also this idea of bioethics and how do you approach these questions from an ethical standpoint. And then we get to Picard and Discovery, and they have these huge questions. And like you were saying, you've got this trauma that continues through and it's informing everything that happens. So it's much more realistic. But it's also kind of difficult to pinpoint like a single ethical question.
Right.
And it's not that that's good or bad. I mean, for my purposes, I want a single discussion point.
Yeah.
Whereas with Discovery and Picard, it sort of stretches across the whole season. So there's not these very simple like aha moments where you can say, okay, this is the question, and this is how I want to feel about it, or this is what Star Trek wants me to feel, because that comes up as well.
Yeah.
But I think there's it's almost like it's tangentially interfacing with ethics, which is interesting.
Yeah, I think it's definitely harder to use as a teaching tool in some way, as we said, because you have to sort of lay so much groundwork. And I think that all of these, the new Treks, Discovery and Picard, are really much more invested in trying to explore character development and character arcs rather than forefronting issues, right? They're less morality plays and sort of like these novelistic explorations of characters and how they deal with situations, which is fascinating. I mean, some really good television, I think, but
it's still about exploring humans.
Yeah.
Which I think science fiction has so often been relegated to, it's just this silly little genre, but it really is just about exploring questions of humanity and how humans respond to different stimuli in this scenario of science fiction.
Yeah, I think that's well put. Are there any more new developments for your class in Star Trek that you're going to be teaching in the next year?
Yes. So I had enough students ask if I would teach a second class. So I've actually divided my class. I'm going to have like my basic bioethics class, which I really like teaching. And then there will be a second class in the spring where it's going to be emerging ethics. So we'll get to talk about the ethics of artificial intelligence, right? And Isaac Asimov has done a lot of work with that. And, Star Trek Data, the positronic brain, was an homage to Isaac Asimov. But how we use artificial intelligence, how we design artificial intelligence, we're going to talk about the use of big data, right? I mean, talk about autonomy. There's so much data being collected about us. Every time you turn on your computer, you open up your smartphone. How is that data handled? What does it tell about people? And I think Star Trek is a really cool way to look at that. So I've tried to look at these aspects that are coming up in science, right? Because science moves pretty quickly, which I know is silly when we look at, these scientific investigations that have taken 50 years. And we're like, well, now we finally know. But think about everything that's happened, right? There's cloning, there's genetic engineering. Even one of the vaccines that's being developed for COVID is a brand new way of developing a vaccine. It's an RNA base. So if science moves that quickly, how do we discuss the ethical implications of that? And Star Trek, because it was so visionary, really, right? I mean, they were thinking about cloning and genetic engineering and artificial intelligence. It is a platform to look at what are some things that could crop up? What do we need to think about? Deep Space Nine does have an amazing episode on potential consequences of genetic engineering because it has to happen before the child is autonomous.
Right.
So you don't get to give consent to be genetically engineered.
Right.
And I think those are fascinating conversations, but more importantly, conversations that need to happen before we implement the technology.
Yeah, absolutely. I think that that's fascinating. Yeah, we're going to have another conversation. We're going to have you back here to talk about
I'd love to.
some of these issues, especially artificial intelligence. It's one of the really big things. And of course, Discovery, the sort of arc of the second season is all about artificial intelligence with control, right? The Starfleet program for security.
Mm-hmm.
And I talk about this in my own class with the classic episode, The Ultimate Computer in TOS. Written
Yes.
Dorothy
I
Funk.
teach that in my class as well.
Yeah, that's chocked with so many different kinds of ways of thinking about artificial intelligence that are still questions that we're dealing with now. And that was from 1965, I think. So.
Yeah, and you can divide the ethics of artificial intelligence into 3 different bins. And so we talk about that a little bit in class and discussion for a later day, but Star Trek illustrates all 3 of those bins. And
wow.
So you can pick an episode for each one to really identify that. Because I mean, obviously, like the original or the Ultimate Computer and then Measure of a Man, I've taught both of them.
Yeah.
And they're both fascinating commentaries on artificial intelligence.
Yeah, absolutely. No, definitely. That's another conversation that we have to have.
Yes.
Yeah, wow. Well, I want to thank you for your time today. I know that you're very busy with your research, and so I appreciate you coming on to talk with us about the work that you're doing and your appreciation of Star Trek and how you're using it.
Mm-hmm.
And want to thank everyone for coming to visit us too and listening in. Tell us what you think. Leave us a comment down below. You can also find us on different social media at Anarres Project. On Twitter, on Instagram, on Facebook, and you can find our website at anarresproject.org. You can also check out some of the other episodes in TrekWars at OSU, in which we are talking about Star Trek and Star Wars and how they help us to think about things. Let us know what you think. Dr. Rohlman, thank you very much for your time. Hope to talk with you soon.
Yes, live long and prosper.
Live long and prosper. Happy Star Trek Day.
Bye.